Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Ceftriaxone. Its brand name is Rocephin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, in this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to give Ceftriaxone. We'll then touch on some examples of dosing, and finish it off with side effects with percentages. I put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Ceftriaxone selectively and irreversibly inhibits cell wall synthesis by binding to transpeptidases, which are penicillin-binding proteins, or PBPs, that catalyze the cross-linking of the peptidoglycan polymers forming the bacterial cell wall. In terms of indications or reasons we would prescribe this medication to a patient, we may see it prescribed in the treatment of bacterial meningitis, as well as in sepsis. This medication can be used to treat an infection of the bone or an infectious disease of the abdomen. Urinary tract infectious diseases may be treated with Ceftriaxone, and there are also other indications. Now, with respect to contraindications or reasons we would not be able to prescribe Ceftriaxone to a patient, well, we wouldn't give this medication to a patient who had a hypersensitivity to cephalosporins. Also, hyperbilirurinemic neonates would not use this medication due to an increased risk of bilirubin encephalopathy. Now for some examples of dosing with Ceftriaxone. So in the treatment of bacterial meningitis, we may see 4 grams per day given intravenously, divided every 12 to 24 hours. In this situation, the maximum dose would be 4 grams per day. In the treatment of an infection of the bone, we may see 1 to 2 grams given intravenously or intramuscularly every 24 hours, or again, potentially divided in doses twice a day. And again, the maximum dose would be 4 grams per day. For prophylaxis for postoperative infections, we may see 2 grams given intravenously 60 minutes prior to surgery. As with all medications, there are some side effects or adverse reactions that patients may experience while using Ceftriaxone, so I'll go over some of those here now. Some patients may experience an injection site warmth or tightness. This can happen 5 to 17% of the time. 3 to 5.5% of patients may experience diarrhea, and 6% may experience a raised eosinophil count. Now, some serious side effects with this medication would be Stevens-Johnson syndrome, toxic epidermal necrolysis, or Clostridium difficile colitis. Alright everybody, that's all we're going to talk about today with Ceftriaxone, or Rocephin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. That's it for today. Take care.